Sugar. Diabetes. Is your sugar sweet blood messing with your love? I am Dr. Sonjia, your sex educator. And did you know that over half of U.S. adults have diabetes or are pre-diabetic? In fact, diabetes affects 29 million Americans. And guess what? Diabetes causes a lot of sex problems. According to the Journal of Diabetes Care, people with diabetes are at higher risk for sexual issues, but are still not talking to their doctors about sex. And I know this is true from my own scientific research, because a couple of years ago, I published a study describing high rates of sexual dysfunction among men and women with diabetes. And let me tell you, I am one of the few scientists to point out that diabetes dries up a woman's sweet stuff down south. So we gotta fix that, right? Now, diabetes also does cause erectile dysfunction and a host of other problems, but we're gonna cover that in a minute. So just to refresh your medical memory, diabetes is a condition where blood sugar is elevated. Now, normally your body produces insulin to break down sugar and process the sugar in a healthy way. And when your body doesn't produce enough insulin, or the insulin that your body produces isn't effective at breaking down the sugar, well, your blood then becomes toxic with sugar, which in effect is diabetes. Now, there's two types of diabetes. Type 1 diabetes, which many people learn about when they're very young. This is due to lack of insulin production to lower blood sugar. And then there's type 2 diabetes. Yes, the one that your auntie has. Well, type 2 diabetes is way more common, and it occurs when people develop insulin resistance. And generally, this is the result of obesity, poor diet, or lack of exercise. And in many cases, all three of those.
My doctor said, look, if you can weigh as much as you weighed in high school, you will essentially be completely healthy, will not have type 2 diabetes.
Right.
And then I said to her, well, I'm going to have type 2 diabetes because there is no way I can weigh as much as I did in high school.
Now, experts estimate that 75% of men and 35% of women with diabetes experience some sort of sexual problem. Physically, diabetes can cause nerve damage, blocked arteries, and throw your hormones all out of whack. Now, when this stuff is on track, this good stuff is what stimulates a normal sexual response. And when it's out of whack, well, your sexual response is anything but normal. Now, you are much more likely to experience sexual problems if your diabetes is not under control. So, if you want better sex, you need to get your diabetes in check. You heard me. If you get your diabetes under control, well, your sex life could get out of control in a good way.
My Uber driver lost his mind the other day, but he blamed me. He said I smelled so good he became too excited to drive. This man actually pulled over to get himself together. And he refused to drive until I told him the name of my fragrance. Then he bought 3 bottles before driving again. I know Sen's body oil makes men crazy, but that Uber ride should be free. What's your Sen's story?
Now, since women should always come first, let's start with how diabetes affects the ladies. Women with diabetes often suffer from thinning of the vaginal wall, weakening of the muscles, shortening of elastic fibers, and loss of nerve fibers. Dang! As a result of nerve damage, women with diabetes may have difficulty producing lubrication, experiencing orgasm, and their desire for sex can diminish. 1 minute she's hot, after diabetes she's not. And one reason is because women with diabetes often have lower than normal levels of estradiol, which is an estrogen sex hormone. The good news is that many women can take a prescribed estradiol supplement orally, through a vaginal ring, or with a vaginal cream, which will help return the vaginal wall back to normal and potentially restore lubrication, comfort, and sexual desire. Now, if for some reason you still lack sexual desire, go to the doctor and get your testosterone levels checked, because testosterone affects libido in both men and women. There are several natural ways women can increase their desire for sex. As we talked about before, healthy diet and exercise will get your diabetes under control. And let me quickly explain how it works. So, after about 30 minutes of moderate to intense aerobic activity, your body, well, it starts producing more effective insulin. However, this effect only lasts for 24 hours, which is why you need to exercise every day. And of course, all this exercise can also result in weight loss. And almost everybody knows that weight loss can increase self-esteem, reduce stress, and increase desire for sex. When you're feeling sexy about yourself, you're more likely to feel like having sex with someone else.
How is sex different now that I've lost weight? My sex life is a lot better now, of course. I have way more stamina. I don't get all tired. I'm not sweating all over my girl. Yeah, sex is better though, you know? My sex drive is better. The quality of women that I had sex with after I lost weight was better, which also makes sex better.
And feeling comfortable with your body is so important for sexual desire and a satisfying sex life. Now this brings me to my next topic. Now, as women and men, sometimes we can be very self-conscious about our bodies. If you have an insulin pump attached to your body and feel self-conscious, you need to learn to love your body and talk about it with your partner. Seriously.
Sierra Sanderson is talking about her insulin pump.
So my body doesn't make any insulin, so this machine is constantly giving me a little tiny bit of insulin throughout the day.
Sierra competed for the title of Miss Idaho, and on the first night of competition, she chose to wear her pump. Sierra says she too was inspired by someone. Miss USA 1999, Nicole Johnson.
She wore her insulin pump on the Miss America stage when she competed and won.
Now, I can assure you that your partner is not focused on your insulin pump. They have other things on your beautiful body to keep them distracted. But if for some reason your partner is uncomfortable and makes you feel insecure, well, you know what I'm about to say. Well, maybe that partner doesn't deserve your sweet loving after all. Situation we're dealing with today Now, one of the best natural ways to produce lubrication is simply stay hydrated. Drink lots of water. It is recommended by diet and nutrition experts that you drink at least half your body weight in ounces of water. Now me, I am slippery slidey, and that is because I drink all of my body weight and then some in water. Seriously, I carry around gallons of water and I'm drinking water all the time. Also, flax seeds, chickpeas, alfalfa sprouts, sesame seeds, bran, and beans, well, all of these foods support optimal estrogen levels, and that will help increase sexual desire. Shoot, you know what I do? I put flax seeds in my shake every single morning. I'm all about prevention, y'all, so I try to get that going before it becomes a problem. You might want to also think about eating some aphrodisiacs, and even though I am not an oyster eater, a lot of people love some oysters to unleash their sensual energy. Oysters are also really high in zinc, and zinc helps produce testosterone. Other foods that help increase testosterone are red meat, crab, and cashews. You know I love me some nuts. But you know what you don't need to forget about? The lube! Don't forget the lube, the lube, the lube! Lube can make sex wetter and better, and can also make touch a little more exciting. Now, I know it can be intimidating with all the different lubricants out there. For women with diabetes, you want to avoid lubricants that contain glycerin because they can promote yeast infections, and yeast infections or vaginitis can be a big problem for women with diabetes. So if you're experiencing itching or burning, you need to see your doctor and get tested for vaginitis and other infections. Most likely, they'll prescribe an over-the-counter or prescribed medication, and you're gonna be good as new, girl. Another good way to avoid yeast infections is to make sure you are purchasing a sugar-free lubricant. Bet you never thought about that. While most lubes don't contain sugar or fructose directly, some still produce yeast infections. You'll most likely find this issue with oral sex and flavored lubricants, so pay close attention to the ingredients when you are shopping for lube. Now, a good option for people with diabetes or those with allergies is a silicone lubricant. Silicone lubricants typically contain just 4 or 5 ingredients and contain very little or even no additives. They're compatible and great for most types of sex, unless you are using silicone sex toys. Silicone-based lubricants are not safe for silicone sex toys because they may damage the sex toys. And you know, we do not want to damage our sex toys. Also, make sure you are using the right amount of lubricant to produce optimal, long-lasting pleasure. There is no need to skip on the slippery stuff. And don't forget to bring toys to your party because decreased blood flow to the vagina, which often occurs in women with diabetes, well, it affects vaginal stimulation. So vaginal stimulation among women with diabetes may not be as sensational as it once was. But don't you worry, girl, as with many problems in life, it can be solved with a vibrator. Vibrators are the quickest way to clitoral stimulation and can help you reach orgasm. And be adventurous with sex toys. Do not be afraid to try something new, because something that worked for you a few months ago or a few years ago, well, it may not have the same effect later. And don't you dare be a quitter, girl. I know you're not a quitter. Something that could be fun for both you and your partner is a vibrating C-ring. It'll help your partner maintain an erection and produce some stimulation for you as well. A penile constriction ring, it's an elastic ring that is placed at the base of the penis to help maintain an erection. It constricts the veins inside the penis to keep the blood inside, and this ultimately prevents the blood from leaving the penis and prolongs the erection. Again, with sex toys, it's all about being open and trying new things. Remember, if you keep on doing the same thing, you're gonna get the same results. And things can be better, I promise. There are also some clinical treatments that you should discuss with your doctor. There's this new prescription medication that the FDA approved last year, and it helps increase sexual desire in women. Well, Fibanserin tricks your brain into thinking that you're aroused, and sometimes a good trick can feel really good in bed. There's also the Mona Lisa laser. This is a non-invasive, non-surgical procedure which targets estrogen changes in the vagina. And studies show that it can reduce vaginal dryness by up to 70%. It can reduce vaginal irritation during sex by 65%, and also increase firmness and tightness in the vagina. Booyah! That's a bang for your buck. Now it is time to talk about how diabetes affects the dudes in the bedroom. Now for men, nerve damage and blocked arteries often occur around the genitals, manifesting in erectile dysfunction. Men with diabetes often experience erectile dysfunction as a result of low levels of testosterone. In fact, a lot of men go to the doctor for their erectile dysfunction, and that's when they discover they have diabetes. Poor circulation, which is caused by diabetes, well, this can decrease libido, which affects your desire for sex. And while low libido can also be a result of weight gain or depression, low testosterone is often the culprit. So if you notice that your desire for sex has diminished lately, talk to your doctor. Testosterone levels can be measured with a simple blood test. And just like the ladies, diabetes can also damage the nerves. And when you have that nerve damage that's causing the erectile dysfunction, that's all because the blood, it just can't gush down south because your nerves are all jacked up. And what is a boner without blood? Well, it's a frustrated man who can't get it up. Fortunately, men have many options for treating or improving erectile dysfunction. Before turning to medication, there's some natural ways to improve erectile dysfunction, which will also improve your diabetes management. First, check your sleep patterns. I cannot say it enough. Stop snoozing on your sleep. Lack of sleep can also cause low libido and contribute to erectile dysfunction. You also need to take a look at your diet and exercise. Remember, sex, it's a physical activity. So if your exercise routine ain't in check, you're probably not in optimal shape for sex. And don't you forget that obesity, not only does it impact your diabetes risk and management, it also impacts your smells and your taste. Now, I once had a client who was married to a man who loved when his wife tickled his testicles with her tongue. However, he put on a lot of extra weight after they got married, and along with that came an extra odor. So it was such a sensational smell that his wife just couldn't swallow it anymore. On the other hand, there are certain foods that improve your taste and erectile abilities. Fruits can benefit persons with diabetes and sexual health, and not all fruits will raise your blood sugar. You know what they say about an apple a day. Well, apples reduce inflammation related to heart disease and diabetes. And reducing inflammation will improve your sex drive. Now, some additional fruits that are great for persons with diabetes are apricots and berries because they are both forms of fiber and contain vitamins. Avocados are another awesome option to improve sexual functioning. Avocados have healthy fats and improve insulin levels. They're often helpful in maintaining a healthy weight and blood sugar, which in turn can help you maintain a satisfying sex life. And you all know what I'm about to say. Avocados are delicious. So even if you didn't know I was about to say it, now you know how I feel about avocados. Now, if you are thinking about getting physical to help your diabetes, you need to think about doing it with your partner. Sexercise, anyone? But first, talk to your doctor about a recommended amount of exercise every week. Remember, sex is a physical activity, so physical activity outside of the bedroom is likely to lead to more physical activity inside the bedroom, and possibly the kitchen, the laundry room, and maybe even the car if you're still that limber. Now, speaking of being limber, try yoga. Yoga is known to increase flexibility, decrease stress, and improve mood, which all sounds super sexy to me. And some guys say it also improves, or rather increases, the length of their love limb. You know what I'm saying? Now, I do have to throw out a cautionary note. Since sex is a physical activity, and I cannot stress that enough, you do not want to overexert yourself. So be sure to check your blood sugar before diving into sex. Now, I know that's not exactly the type of foreplay you were thinking about, but it'll help you avoid passing out and having your partner freak out. Now, some pharmaceutical options for men with diabetes could be popular erectile dysfunction drugs such as Viagra, Cialis, or Levitra. Testosterone treatments are also available. Penile constriction rings. Now, these might also be helpful for erectile dysfunction.
First, you push the testicles through and then pull the scrotum in. And then the flaccid penis is pushed through. Don't try to do this with a hard cock, it'll be much too difficult. Nice and slowly. And then you can adjust it against your body. Take your time, you don't have to rush it. Just get it in the spot that's most comfortable for you. Like so. Due to blood flow restriction, the cock ring wearer can experience a harder erection. It can also help them last longer. So this is a great toy for any man who suffers from premature ejaculation or erectile dysfunction.
Men with diabetes should talk to their doctor about all of these options, not just the popular drugs we all hear about. Be sure to ask your doctor about penile sleeves, vacuum pumps, erection injections, suppositories, and surgical implants. Before investing in any of these products, make sure you really do your research. You want to find places that are committed to enhancing your love life and, most importantly, your sexual well-being. Begin by asking your current doctor or pharmacist for recommendations. Your current doctor, the one that you go see at least once a year, right? Well, your current doctor and your pharmacist, they should be able to help you find products that are proven to work and may be covered by your health insurance too. Now, before we go, I want to make sure that everybody understands that diabetes can also impact mental health. And mental health, it definitely influences sexual satisfaction in both men and women. There's a lot of pressure that we put on ourselves or pressure that we may feel from our partners to perform. And when that desire disappears, or we are simply physically unable to please ourselves or the other person, depression and anxiety might be the issue. In the last study that I did among people with diabetes, nearly 80% of participants met the clinical criteria for depression. Now, the upside is many of the behavioral interventions that we discussed today, such as exercise, can also improve depression symptoms, because when you exercise, you actually release a lot of the same feel-good hormones that are released during orgasm. That's one of the reasons you feel so good when you leave the gym. Maintaining sexual health is all about being healthy in body and in mind. And let me tell you, discovering your sexual desire after it's diminished, it can be so much fun. So be open to trial and error and seeing how your body responds, because you deserve a fun and fulfilling sex life. I'm Dr. Sonjia, and I'm so happy you joined me today. And I look forward to seeing you again soon at Sex in South Beach, where everybody comes for healthy, happier sex.
And today's homework is go to sexinSouthBeach.com, join the VIP list. For your daily dose of nooky knowledge, subscribe to my YouTube channel and link up with me on social media. For better sex tonight, pick up my book at Amazon.com, and you don't want to miss the Sex in South Beach podcast on iTunes and sexinSouthBeach.com, where everyone comes to learn about sex.
Sugar, sugar, sugar,
The information provided in this video is for your education and entertainment and should not be used as a substitute for medical advice. Before taking any medications or making any changes to your health behaviors, talk to your doctor.